Shoulders. Here we go, and we are live. Well, thank you, everybody. I am Jay Allred. I am the president of Source Media Group, which you may know mostly as Richland Source. And we're so glad that so many of you have joined us today for this webinar about elder care during the coronavirus shutdown and potentially after that. This webinar is brought to you really with the generosity and the support of our membership and our newsroom partners, and we're really proud to have two of our key partners, both from 2018 and also from 2020, with us today, and I want to introduce them to you. Duana, Patton, the CEO of the Ohio District 5 Area Agency on Aging. I've worked hard on that. And also Teresa Cook, who refers to herself often as Duana's doppelganger. I mean, they work so closely together and deliver services to our area seniors and the folks that care for them. And we are going to be here today, and the way that this format will work is we'll just do a few intros. We'll let Duana and Teresa introduce themselves briefly, and then we'll kind of spend the first 20 or so minutes on some guided conversation, and then we're going to open it up to your questions. Brittany Schock is joining us from our editorial team. Brittany Schock is joining us from our editorial team as our producer, and she will also, that should help. She will also be helping us manage your questions and answer your questions in the chat. So we're glad to see Brittany here with us. And so I guess we'll just kind of get started. Tell us a little bit about yourselves and how are things going at the area agency right now, guys?
So again, my name is Duana Patton, CEO of the Area Agency on Aging. And how are things going? I'd like to say it's business as usual to the greatest extent possible. Things are different, and the people that we are working with are working differently, and the consumers that we are serving are, presenting, different needs than they have in the past. But we are full speed ahead in doing what we need to do on a daily basis, and just grateful for this opportunity to really talk with you, Jay, and the rest of the listeners and viewers to ensure that we can together get the message out to the community who, will really support the seniors and the most vulnerable during this difficult time.
Well, that's great.
I'm Teresa Cook.
Go ahead, Teresa.
I'm sorry. I'm Teresa Cook. Been at the agency over 20 years, and the people that answer the phones are in my division, and so we're really excited to move into this new challenge, and I know the staff are up for that and to bring the information to the public.
That's fantastic. We really want to thank you for being here. I want to dive right into some of the questions that we have so we can kind of help folks know. And I think one of the things that we could start with is to just ask, as we were preparing for this, one of the things we were looking at is how can we be good neighbors for our elders while still respecting the state orders? Do you have tips or ideas?
Certainly. So in the state order, there are many exemptions to the stay-at-home essential businesses and so on and so forth. And I'm really grateful that our governor recognizes the importance of people helping people. And so one of the things that is permitted is that people can go out, they can get fresh air, and they are also permitted to help their families and their loved ones and their neighbors in this time of crisis. So we encourage people to get out and to check on a neighbor, making sure that they have essential, items, food, their prescriptions, and maybe just sometimes the fact that they know that someone is listening and caring about them is just assurance for them as they are becoming more isolated in the home. So if someone needs to go deliver a meal to an elderly person or someone in need, the order from the governor allows them to do that. So we encourage people to do that, but we encourage them to do that in a very mindful way, checking their temps before they go out, making sure that they aren't making our vulnerable citizens even more vulnerable. making sure that they're well when they are helping others in need. If they can't get out and help someone, and it's just not conducive to them, pick up the phone, call an individual who might be isolated, a senior or someone that is disabled. Pick up the phone and just say, "Hey, I'm just calling to check on you. How are things going?" And then if that person is in need, we always want to be that resource to help.
It's interesting that you mentioned that, because I think that you really bring up something that's really important. Folks have been so mindful of Dr. Acton and the governor's press conferences. They're probably setting all ratings records for governmental press conferences right now. Certainly, it's driving a tremendous amount of traffic on Richland Source, and so people are interested in it. But I think they're trying to pay so much attention to social distancing. It would be easy for that to get lost in terms of, well, I just can't go out of my house at all. I can't even help people. And what I'm hearing you guys say is that it's completely okay if we maintain the guidelines that Dr. Acton is sharing with us about effective social distancing and sanitization, that it's entirely okay to bring a casserole or some canned goods, or just to walk down the street and check on your neighbors.
Absolutely. And I think sometimes, and I am so grateful for our leadership here in the state and the things that they are doing to really set Ohio apart from many others. And we're very fortunate that they are mindful in, what makes sense. Mm-hmm. And social distancing is important. And we are practicing that here. And we are asking our staff to do that if they are working, remotely. It is important to then realize, what do we have to do to get vital services and supports to people? So if an individual is utilizing the drive-through, at a restaurant or at the pharmacy or at the bank, there are some moments in that interaction where you're not going to be 6 feet apart. And right. I think there's where the next step comes in is, if I'm doing that, am I sure to, wash my hands and before and after a transaction? Am I using hand sanitizer? Am I covering a cough? Am I well? Have I first checked right. my temperature? And I think that is first and foremost. Do I feel well? Do I have a temperature? If I don't feel well, and if I have a temperature, then social distancing needs to be maintained at its greatest, meaning I need to stay home. I need to stay away from my family and my friends. And so we have people that aren't, finding themselves ill and should be and can be, engaging in, the activities that allow me to help other people, which is why there are many of our staff that are still here. We're a very much a skeleton crew, mainly just the people at our call center, but others are working remotely.
Well, and that's a great segue into my next question is, what should we absolutely not do? I mean, besides the obvious, like don't go around licking doorknobs and stuff like that. But, I mean, what should folks absolutely not do, in the sense of, they want to be helpful to our elder population. They want to, they want to make sure that they have the information that they need, but being mindful of the situation that, our elders might not have. I mean, my mom's never had a Facebook account and she's never been happier. So like there are some generational differences that our elders exist in. And so I'm interested both in the things about sort of the obvious things about health and wellness that you talked about, with regards to taking your temperature, if you're illness or, if you're symptomatic, really don't go over to visit Aunt Betty. Find another way. What other things, like should we be careful about, repeating every Facebook rumor that we hear, or sort of over amplifying information that may or may not be constructive? Can you talk to us a little bit about what other things that we really shouldn't do? It might feel helpful at the time, but it's really not helpful.
So I'm going to just say a couple things. I'm going to turn this over to our expert here, Teresa. Facebook and media and, all of that is great. And it's even more important in a time like this. But I do urge individuals to be careful where they're getting their information. Trusted media sources are great, as are many of the sites that the state has put out as resources. And I think those are on our Facebook page. We'll make sure that we put them up again today. Trusted resources. And when an individual isn't sure about the interpretation of some of the executive orders that have been put out, go to the ohio.gov site and, get the clarity on the frequently asked question page. I think, again, Facebook is a great way to get information out. I think we need factual information, and the positives are real important, because people that are isolated are utilizing that as a way to keep in touch with others. Mm-hmm. And the more positives that we do are critical and real important during this time, because people, they're dealing with their own issues, and the most positives that we can give out and help that is real and true is good.
Okay, that's awesome. Thank you. I want to pivot just real briefly here and ask a little bit about how you'd mentioned that the area agency is you've kind of gone remote. There's a little bit of a skeleton crew still at the facility. Talk to us a little bit about how the area agency is serving its clientele now, and what's changed. So, what should your clientele and the folks that care about them expect, and what's changed?
So we serve all individuals in the aging population. Some of the people that we serve are already connected and have been connected prior to the crisis. They have a case manager. They have a connection to this organization. We used to go in the home and do face-to-face visits. We are no longer doing those. So a lot of telephonic case management is happening with our enrolled clients. Those that are reaching out to us for the first time, they can expect someone to answer the phone. They may not have the answer readily available. We are, constantly building our resource database. So we may not have information readily available, but we want the questions. We want we want them to share their needs. And we are finding ways to be very creative with our service providers, with our funding sources, to meet the needs that we haven't in the past. And Teresa, if you want to add anything about the front door and people calling in.
The area agency, we're an Aging and Disability Resource Network, and we now have that ADRN call center. One of the great things about our call centers, our staff, is they're really good listeners. Sometimes the call that just starts, they need someone to listen. We had a lady who was in her late 80s, felt she couldn't go out in her backyard because of the information coming through. So we were able to have a staff person have that conversation with her, say, it's a good thing to go out and get some air and feel the sunshine. So we took that stress level where she was afraid to step out into her backyard to now she felt more comfortable. We're getting a lot of those kind of questions. Also the day-to-day, what do I do now? Because now the state is shut down. And like Duana was saying, that's those trusted sources. We have staff that are answering those calls for the most part live, and we're really proud that the staff are stepping up and just doing above and beyond to answer those questions. And so we're here Monday through Friday, 9 to 5. They can give us a call at 419-524-4144 or our website 24/7. We have a site on there where you can just ask us a question and we will get back in touch with you.
Can you repeat that number so Brittany can get that into the chat for us, Teresa?
Yes. 419-524-4144. Monday through Friday, 9 to 5. Staff will be answering the calls.
Monday through Friday, 9 to 5. Great. That's a great number for them to call for seniors who are looking for information. That's a good starting point for them then.
Yes, we would love to be that starting point. And even if you're the daughter and you're dealing with aging parents and you're not sure what's going on, even if you're out of state and now mom's here and you're reading all this, but you're in a different state, have those questions and resources, please give us a call. We would be happy to help you navigate that. And we have a large database with information.
Great. Let's talk a little bit about let's talk a little bit about something that we talked about in the green room today, which was scams that we're starting to see for our seniors. Unfortunately, the governor's order for non-essential businesses to shut down did not include criminals. They are active. You know, our contacts in law enforcement tell us that this is, it's opened up a whole new gate of interesting opportunities for criminal elements that particularly prey on people that are stressed out, on the elderly. We talked about this in our last webinar from yesterday with Chris Heiner and Mark Masters of Richland Bank and Mechanics Bank, respectively, that they are starting to see reports from customers about fake callers from the FDIC that want to verify the amount of money that is in their accounts and make sure that everything is okay. So I would imagine that this is probably happening on your end. Can you tell us a little bit about what you guys are hearing and maybe provide some tips for both our elders who are on the call, but also for the folks that might be caring for elders that are on the call?
Great. So yeah, we are definitely watching and listening to our constituents, providers across our region and the state, because I think these scams are going to begin to surface as we go through the days. We're paying attention to those. We'll make sure that if we hear of a specific scam, we'll get that up on our Facebook and on our website. We'll be sharing that with our local partners through email so that the more that we know about it, we can get it out to the seniors. We don't know what these criminals or these bad people will think of, but I can guarantee you that they will take this crisis as an opportunity to scam and to really, connect with our most vulnerable citizens. So and I think what we have to remember, what I like to tell seniors is go to the trusted individual in your community, the banks. They are still operating as an essential business. They're maintaining, just as you had indicated with our local bankers here, they're in the know and they know what's out there. So I always recommend that people go to their trusted source first, share what they're hearing or what they're being asked to do or to provide. Let the banks, let other social service agencies, members in their church, someone that they trust. Always vet through something that you might question. Follow your gut and vet it through a trusted source first. And just be mindful of, who's engaging, who's coming to your door, who's calling you, who's reaching out to you. We now are seeing more and more seniors who are utilizing this time to get used to Facebook and different social media platforms and the computer, and they don't know what we know, that people will reach out through the computers, through emails, and not everybody has good intentions. Yeah,
my mom just got her first email address 3 weeks ago, so God love her, so she could sign up for my Sunday wrap up. And I thought that was so. First of all, I was honored, and second of all, that was kind of cool. But I think that you're really touching on that piece that we have to be mindful that there is a generational shift sometimes, and that what my 17-year-old daughter is super comfortable with may not be applicable for her 75-year-old grandmother, and we got to be we have to be honest about that. But one of the things it sounds like I'm hearing today is that this would be another good use for the 419-524-4144 number.
Please.
If you've been approached via the phone or other means by something that feels a little weird or suspicious, it probably is. And calling 419-524-4144 at the area agency might be able to be a good starting point to find some answers.
Yeah, most definitely, because we do stay on top of that. And sometimes it's just when the individual on the phone talks it through, they're like, well, that doesn't make any sense, but you just need someone to have that conversation with. And if you're alone, you might not have that. So yes, please give us a call.
So one of the last questions before we start to open this up for audience questions, and if you have a question and you're on the call today, go ahead and post your question in the chat or use the Ask a Question feature so that we make sure that we get that in front of Teresa and Duana and do our best to get that answered for you. But the last question before we kind of move to those audience, the audience input is that I'm a little concerned about isolation for our elders. During our series Grit Matters last year, we did a lot of reporting on this. It's absolutely something that is reported over and over again. It's a hard thing, particularly for our elders that are living alone or that aren't able to have a lot of contact with folks. It has to be worsened in this situation because not only are, they might be dealing with sort of living by themselves and not having a lot of outside contact, but the news is not good. And this has to be worrisome sometimes. What are some ways that regular citizens can help?
So I think there are a lot of great examples. I've seen a lot on Facebook, but one of the things that, two things here, we have seniors who are, living alone or with family, feeling isolated. We also have individuals in the nursing home. So here's just a couple quick tips for listeners and people that can share more information about this. We have all the kids are out of school, doing their education online or at home. I encourage folks to think about engaging these students in connecting with others, in the community, specifically seniors. So I have seen groups or individuals who have said, I'm just going to write letters to the seniors that are in the nursing home. And here's what we have to remember about the folks in the nursing home. They are not getting visitors. They are relying on the TVs for updates on what's going on. But wouldn't it be great for them to see this crisis through the eyes of a child or the eyes of a youth? Dear senior, my name is such and such, and I am, getting the rest of my education this year at home through the computer. And here's what we're doing, at home to keep ourselves safe in this time. Because that's the stories that we want the seniors to know. My mother-in-law is in a nursing home, and she's like, well, what's it like out there? What's it look like out there? She doesn't know. She only knows that, what's outside of her window. And so when I can talk to her and let her know, well, when I drive by the mall, there's no cars there now. The mall is pretty much closed down except for the hospital part. I'm going to work and I'm able to get my coffee and I can go out and get my lunch, but it's always at a drive-through. They want to know what's going on around them. So we have to think about people in the nursing home and those cards and a letter, maybe a package with, a little something, a puzzle book or a coloring book just goes a long way to warm their heart in this time because the crisis for them is different than what we're living every day. People at home. Yeah, go ahead.
And isn't it interesting that I think that it's important to remember here that many of the folks that you would be writing to lived through the Second World War.
Yeah, right.
They're no stranger to crisis. They grew up in an era where you could get polio. They witnessed, they lived through and maybe even participated in the Second World War, certainly the Korean War and the Vietnam War. This is not their first rodeo. So it makes me think a little bit about not only how we can contribute to them, and how we can make them feel better, which we should be doing, but there's a lot of wisdom there that if you're mindful about engaging these folks that have literally seriously been through worse than this, there might be something we could learn from them.
I'm confident that there is, and which is another great way to engage people who are alone at home, and folks who are trying to go about their normal day, is to reach out to that senior and let them know what's happening in your world, but say, hey, what was it like at such and such a time, and get them to talking. Social isolation just lends to so many other health issues that again, a card, a phone call, a hey, how are you doing, just goes a long way for really anybody, regardless of age. It's just important.
Okay. All right. I want to move. I want to move to questions that we've got from the folks on the call, and we're super excited because we've got some great questions and comments from folks on the call. And so I want to start with one that we got from Rachel Troyer, who it's a little less than a question, but I think it's interesting to talk about, is that you may be able to talk about this from the area agency's perspective, but Rachel Troyer says, remind everyone that most churches are having daily devotionals online and Sunday services as well. This is a great place to focus and help with feeling isolated.
Mhm.
How about, how does the area agency interact with communities of faith, and what are you guys seeing on your end?
That has always been a great resource for us, working with the faith-based organizations and all the churches. So we have been reaching out to who is doing what, and we're compiling that. And a lot of the churches have responded. They have the online services, or maybe they have the grab-and-go meal that they're passing out. So if someone is interested in what's going on, please give us a call, because we're putting that database together, not only for Richland County, but for all 9 counties that we serve.
That's fantastic. Thanks. And thanks for asking, Rachel. Let's see. Our next one was G. Mayers. He doesn't identify, or she doesn't identify her first name, but we're starting to use the term physical distancing here instead of social distancing, as people have been worried about isolation. I think Dr. Acton talked a little bit about that a few days ago in her press conference, in that social distancing is sort of a scientific term. But what she's really talking about is just, let's have that buffer zone of 6 feet or more when you're talking. Do you have you seen that? If we can circle back a little bit, early on in the call, you guys mentioned that it's perfectly okay to bring cookies or something to a senior. Just use the proper protocols.
Correct.
So,
and
no, go ahead.
Yeah, I appreciate the change in terminology, because social distancing does imply something a little more emotional than physical distancing. Physical distancing, we can get that, but I do think that social distancing, you're right, it's a scientific term that many have used for years. But what we really are asking people to do is not to distance themselves socially. We're asking them to distance themselves physically. And I think, the listener's point is well taken, and we should be using, all of us should be using that terminology when we're having conversations with people. You don't have to socially distance, because there are so many ways to stay socially connected, especially today, but that we want that physical distance. And when we need to connect closer to people by virtue of, interactions for delivery of food or goods and services, that we do that in, again, a mindful way that keeps ourselves and the other individuals safe.
Great. And if you're on the call today, don't be afraid to drop your questions in the chat. We've still got a little bit of time with Teresa Cook and Duana Patton from the District 5 Area Agency on Aging, as we talk about elder care in the midst of the coronavirus. Barbie has a great question here. I really like it. My parents are 86 and 88, and they are highly mobile. They want to go to the store during early special senior hours. Is this okay for them to do so?
It certainly is. If, as Duana said earlier, if they're feeling healthy, they're not running a temperature, and they want to get out during those early morning hours and go to the grocery store. My mom loves doing this. And one thing I said to her, I said, well, just put a little pair of gloves on. You have all kinds of gloves, because she's worried about touching things. Yeah. And then when you get home, throw the gloves in the washer or the disposal ones and throw them away. That gets her out of the house. I've offered to bring groceries. She shouldn't want to do that. I'm happy that she still has that independent spirit and is not going to let this define who she is. Right. I want her to be cautious. I want her to use the hand sanitizer, but just getting out of the house to go get a few groceries does a world of good for her. And so we want people to not be so afraid that they have isolated themselves when they don't have to. If she's feeling ill, I certainly want her to stay in, but if you can get out, it's a good thing.
Yeah, that's a great question, Barbie, and thank you guys for the answer. So Dave P. asks a question. My wife and I are 65 and 67 and still very healthy. What services or resources are available that we may not be aware of? And is there a good website with information pertinent to us? And I bet I know of a good website that would have information.
Yeah.
We do have a fantastic website. It's aaa5ohio.org. And we do have a lot of different programs and services that are not just for someone that might be frail or need those in-home services. We have wellness programs. We have Matter of Balance, a falls prevention class. Unfortunately, right now, those are shut down, but you can get information about those on the website. We have information about different trainings and different types of programs. We have a lot of different things go on at the Area Agency on Aging besides those in-home services, which is a key part of what we do. But we have a lot of things for people that are young and healthy. So we'd love to make connections with you.
Great. Okay, this is great. So Mr. Mayers asks, he says, I like the idea of social connection and physical distance, as that seems to make people creative. Here in Switzerland, we have a person logged on from Switzerland. I'm from Shelby originally, where I live. At 9 p.m. every evening, everyone wants to open their windows and goes outside and rings bells, claps, or plays music for 3 minutes at the same time to say thank you to the health workers and connect together. Okay, so first of all, we have someone logged on from Switzerland, and this is talk about scale and global, and we're taking the District 5 area all the way to Europe. So thank you so much for logging in from so far away. How cool is that?
Very cool.
You know, we've seen some videos. We have seen some videos from Italy and from other places where music and outdoor activity is really making a difference. And I know, like, my mom walks every day, and that is just, you know, makes her sort of feel connected. I find myself walking the dog a lot more often than I used to now that I'm here at home, and it certainly helps me. But what a great suggestion from Mr. Mayers. I'm sorry, from Jillian in Geneva, Switzerland. So it's not for Jillian. So welcome, Jillian. We're so glad to have you. Amazing.
So I think that is a great comment, and thank you for listening and being here with us. We have a lot we can learn from, other parts of the country, other parts of the state. We are staying very connected and trying to be apprised of some of these creative things that can be done. We don't know how long this is going to go on, but it is the time for looking at things in a very innovative way. So Teresa had mentioned our wellness programs that are not taking place in the manner in which they used to be done. And I have challenged my staff, now that we've got everybody remotely working and we've worked through all of that, it's really time to think about now, how are we delivering the services that we can't deliver in the manner in which we've always done it? And, are there ways that organizations and individuals can say, okay, let's just do this different. Let's have people get out at a certain time and do something, or let's make, you're doing it through this, this venue today. You're keeping us connected in a way that you haven't done before. We need to think about that. How can we do a wellness program with the tools and the resources that we have available today? How can we continue to do fun and things that just keep people connected? So it is. I think it's a great comment, and I think we should all really dig deep and think so far out of the box that we're not losing sight of the things that were important prior to COVID-19. To say, okay, that was really important and it had value. How do we do it today?
That's fantastic. Jillian also asked a question earlier on about services that are available in Shelby in particular to help our elders. Her parents are in their 80s and live in Shelby. shopping, remote shopping, other needs. I've seen things in Mansfield, says Jillian, but not yet in Shelby. Can you guys provide a little bit of perhaps some insight into what might be happening in Richland County's second largest city?
Do you want to take that one, or
we are? That's the database we talked about. We again have reached out to all our 9 counties. So if they want to give us a call, we can drill that down to the Shelby area and what's exactly available in Shelby, whether it be the shopping or what's going on. So please call us. Yeah. We'd be happy to talk to you.
Yeah. We have some staff that are helping us build that database, reaching out to, I think someone had mentioned earlier, we do serve 9 counties. So we are, we've got staff engaged in reaching out to our senior centers who, by executive order of the governor, are closed, with the exception of essential services such as meals and transportation. So all the social activities that were happening at senior centers aren't. So we are reaching out to them to find out what's happening in their local community, including Shelby. Great. So we want to make sure that we are, touching all counties that we serve and the respective smaller communities within those counties, and getting those onto our database.
That's fantastic. Thank you. And I know this last person here, Brittany Schock, she asked that question. And she said, in the same vein, what's a favorite example of yours of an uplifting story about people reaching out to elders or senior communities? I mean, have you seen some things that just have warmed your heart, and that perhaps some of our listeners or attendees might be able to be inspired to try on their own?
So I think it goes back to again, the letters and the phone calls, which, I think anybody can do. I love the stories of families visiting loved ones who might be in the nursing home or, even at home, but yet don't feel like they should, compromise the health of an individual. There's a nice barrier between someone and a window that, typically we wouldn't think that, that would even be appropriate. But I know folks that are, just going to the nursing home and at least waving or saying hi through the window or cell phone through the window. I think those are just beautiful stories. I saw a grandma visiting her grandkids through the window because the kids were sick. But that didn't stop her from seeing them or putting her hand up to the window. It's just amazing how we can think creatively about connecting with people without having to touch them or be very close to them. Those barriers between people. I think also employers who have skeleton crews at their offices like ours. We are dealing now with how do we keep our people connected? It's no different, from a social aspect. We just have to think differently. And we went, our team went 100% remote this past Monday, not yesterday, but the week before. And it's been interesting how these different connections that are so natural in a place where you're all together, how these social connections between staff members and people that are in your natural communities just have to be a little bit more mindful. You have to think about them a little bit differently than you do where you just kind of accidentally get to bump into each other and learn what happened over the weekend. You have to actually ask that question. And it's interesting. One of the things that we did just this past Friday for staff, which was a little different, was in a situation like this, we would normally be all together. So in a crisis situation like this, as a news organization, we would normally all be together. And oftentimes that would mean we would order dinner because we were working late. So on Friday, what we did was we ordered dinner. We ordered a pizza for every one of our staff members at their home. So we could have pizza together, but be apart. And there's these little weird things I think that you can do that you just try to bring people together in that way. Well, listen, we've kind of come to the end of the questions for for 3 days, and it was pretty. And so that kind of stuff doesn't cost a lot of money, and it supports local businesses, and it helps sort of
helps people stay together in their heads if they can't be together physically. So I just
Very
want
true.
to circle back to a couple of points that I thought were really important, which was, number one, social distancing is really more accurately described as physical distancing. And it is within the governor's order presently that if you have a neighbor or an elderly loved one that you know lives alone, there is no reason why you can't make them a casserole and maintain the 6 feet distance between them and deliver a sandwich or dinner to them and a short conversation. That's completely within the guidelines. And so we don't have to, we can help mindfully with that isolation that can happen with seniors. That was something I did not know. I wasn't sure, and I'm glad I asked. It's also okay to encourage to write letters to seniors. It's important for them to see that and to recognize that the communication technologies that might be native to a 25-year-old are not necessarily native to a 75-year-old. It doesn't mean that they can't or they won't. But it just means that sometimes, you know, defaulting to an analog method of communication is sometimes going to be just as effective. And it's a great use of kids that are home from school.
It certainly is. Yes.
So I just want to, as we kind of close this out, this lunch and learn, I want to make sure that first and foremost, I want to thank our guests, Teresa Cook and Duana Patton from the Area Agency on Aging District 5, for lending their time over their lunch hour to help us connect with elder care in the midst of the coronavirus. If you'd like to revisit this conversation, this video will be published on richlandsource.com in the coming days. And you can actually, if you're here with us today, this conversation is being recorded. And so you can always log back into your Crowdcast account and watch it. And you can also share this conversation to your Facebook page right from there. So there are share buttons that you'll be able to help us get this dialogue in front of more people, which is immensely useful and helpful to us. We want to thank you all for your time and attention. We say this all the time, but it's really the Source's mission to do journalism with people instead of to them. So your participation today, you're really helping us live out our core values as a journalism organization. I'd like to offer, if you'd like to continue to support local journalism through this public health crisis, you can do so at sourcemembers.com. Join us tomorrow at the same time. We've got, I think we've got 2 or 3 weeks of these scheduled out right now. So join us tomorrow at noon. We're going to be talking about small business resources in the time of coronavirus. Jody Perry, who's the CEO of the Richland Area Chamber, and Jennifer Kine, who is the CEO of Downtown Mansfield. It's going to be a great conversation. I just want to thank everybody again. Stay safe and stay healthy, and we will see you again tomorrow at noon.
Thanks, Jay, and thanks everyone.
Yep, thank you guys very much. Appreciate it. Have a great day, everybody.
All right. Yep.
All right, bye-bye.
Bye.
Bye-bye.